The WHO has labelled a subtype of the COVID-19 virus first discovered in India as a variant of concern. It's a chilling phrase. B1617.2 is thought to spread more easily. The subtype is responsible for the majority of new cases in parts of England. Germany has banned all travellers from the UK except its own residents due to concerns about the strain. But there is some good news. The vaccines from Pfizer-BioNTech and AstraZeneca are thought to be highly effective against the variant after 2 doses.
I'm Ben Fazul, welcome. Just when we could see light at the end of the tunnel and so much of the world was getting vaccinated, up pops a new variant that has scientists worried. I asked epidemiologist Eric Feigl-Ding to give us the specifics on speed of infection.
Right, so in terms of transmission speed, B1617.2, the Indian variant, is spreading faster than not only the Wuhan original strain, but also the UK B117 variant. It is about anywhere from 30 to 50% faster than the UK variant and about 2 times faster than the original Wuhan. That means it is more contagious. It travels from person to person much faster. And this is a serious problem because what used to work in terms of mitigation will still work, but won't work as much. It is a tug of war in this race against this virus. And so mitigations that used to slow down the virus may not be enough with a more faster transmission variant.
Can you also put it into context for me in fighting this pandemic, where it puts us? Is this worrying for you?
This is worrying, definitely worrying, because a faster transmitting variant will be the one that spreads and spreads faster and to more countries. And now in the UK, it's spreading so fast that it is now replacing the previously fast variant. UK previously, the B117 took over the UK over the winter time, and now is, until recently, 100%. But the Indian variant is so much faster that it is now even replacing the previously faster variant. And now it's 50% overall of total cases in the UK, 70% already in some parts of the northwestern UK. And these are not traveler cases. These are community cases in the UK. And now hospitals are surging, and pediatric infections are also surging wherever this Indian variant goes.
The speed here seems to be very telling. A doctor I spoke to just last week said that COVID doesn't mutate as quickly as something like the flu, and that she wasn't too concerned that efficacy of vaccines was going to become an issue. Is it now becoming an issue?
I think it is becoming an issue. Public Health England over the weekend put out a risk assessment. They have updated a risk assessment that not only transmission speed, they have greater confidence it's faster, but vaccine efficacy, they say with 1 dose is only 33% with the AstraZeneca vaccine. And 2 doses, it's only 60%. Now, don't get me wrong, 60% is against symptomatic illness is definitely good and much higher likely for severe illness, but that excludes asymptomatic. And we know that asymptomatic is oftentimes efficacy is much lower than symptomatic. So if symptomatic efficacy is only 60%, 60% reduction compared to no vaccine, that is good, but not foolproof anymore. And that is a problem. Granted, Pfizer vaccine efficacy against B1617.2 is a little bit higher. It's 88% with 2 doses, but only 50% with 1 dose. This is much lower than what we know against the other variants. And so with 60% AstraZeneca efficacy, which is AstraZeneca is 2/3 of all vaccines in the UK and a large majority of the vaccines in India and as well as the world, we know that it is not foolproof for slowing down the virus entirely. It is 60% efficacious.
OK, we'll have to leave it there. Eric Feigelding, thank you very much for joining us today.
Thank you.
Well, officials in the UK are in a rush to fully vaccinate its population due to the variant. DW's Charlotte Chelsom-Pill reports.
As Bolton queues, Britain waits. Surge vaccinations are underway in this northern English town to combat a rapid rise in cases of the COVID-19 variant, first identified in India. It's already the dominant strain here and is likely to become dominant nationwide.
What we've noticed is with our infection rates in Bolton, that the transmission has been happening in the younger age groups. I've been putting a lot of pressure on central government, especially to make sure that we can roll out the vaccination as quickly as possible. I mean, essentially what I've been saying in recent days is that we have to vaccinate the whole of Bolton before the end of May.
This is a delicate moment in the UK's fight against COVID-19. While thousands have been vaccinated here in the last few days alone, these measures are unlikely to contain the spread, with the same variant already detected in dozens of areas in England.
The UK has had a successful vaccination campaign so far. Some 70% of adults have had at least one dose. But that still leaves a considerable number who are unvaccinated. And authorities here are warning it's among that population that this strain could spread like wildfire.
This variant is considered more transmissible than the UK's dominant Kent strain. What isn't known is by how much. A significant increase could see hospitalisations surge. But there is reason for hope. In Bolton, the majority of those in hospital haven't been vaccinated, despite being eligible, a sign vaccines are working.
The information that we've seen at JCVI suggests that our current vaccines do confer immunity against even this new variant. We're picking up novel virus infections, but we're not seeing severe disease emerging in a fearful way. So I think it's quite likely that we'll probably be able to vaccinate our way out of this one.
As some remain cautious, others are enjoying newfound freedoms. Socialising indoors returned across the country this week, with all restrictions due to be lifted in just over a month. But the government says the next few days will be key. Data on case numbers and transmissibility will help determine whether England continues down its path to freedom or puts the brakes on its roadmap out of lockdown.
To our science correspondent, Derek Williams, with your questions on the coronavirus. This time a question about variants from a different perspective.
As the SARS-CoV-2 virus inevitably continues to mutate, could it also mutate to become less deadly?
This is complicated, but here goes. The short answer is yes, that could happen, and we hope it will, but there's no guarantee. Scientists used to believe that pathogens always evolved to grow less deadly because it was thought a deadly disease is an ineffective disease. The reasoning was that if a pathogen kills its host, especially if it kills that host quickly, then it lowers its own chances of being passed on. So less deadly, more transmissible variants should have an evolutionary advantage, right? Well, the problem with that logic is that virulence can also be viewed as an advantage because the sicker the host grows, the more likely they are to give their pathogen to someone else, since they're shedding more of it. So we actually think there's kind of an evolutionary trade-off between transmissibility and virulence. And there are certainly pathogens, for instance, the tuberculosis bacterium, that have been infecting humans for thousands of years, yet still kill large numbers of people. To see what the future might hold for COVID-19, therefore, scientists have been looking at the other coronaviruses known to infect humans, in particular the 4 that we think have been doing it for quite a while. They only cause mild cold-like symptoms. Interestingly, that might have less to do with them and more to do with us, especially with our children. One theory is that repeated exposure to those other coronaviruses in early childhood might be helping to prevent more severe cases of the sicknesses they could cause later in life. If SARS-CoV-2 does become an endemic background illness in our societies, then later generations of children will be exposed to it early, at an age when it rarely makes you seriously ill. And that in turn should make subsequent exposures much less dangerous, or at least that's the hope.
Now, when life gives you lemons, make some lemonade. Or in times of COVID, if life gives you a pandemic, try to have some fun with it. A Hungarian entrepreneur has turned the hunt for a vaccine into a video game.
Did you include the Indian mutant? Yes, they are the red ones. So the yellow one is the normal virus. Escaping the virus with a swipe of a finger. It can be so easy, at least in this smartphone app. The goal of the game is to collect vaccines. You have a little man wearing a mask, and the main task is to avoid the viruses. Of course, there are normal viruses, and there are the mutant ones, which of course are much worse. The free game is supposed to bring in big business for Griff Collections, a Hungarian fashion retailer. When his stores had to close, Zoltán Suto had to focus on online sales. But how to lure people to the website? His kids took up the challenge with a game that nets players' points convertible into real money, discounts for the brand's clothes. It's unclear when business in stores will pick up again. Until then, the Sutos keep playing, hoping that everyone catches the vaccine soon.